It's having entropion, so you can see this, that these all hairs are going inside the inside this area completely, and there's complete inversion of the whole lower eyelid, plus even the upper eyelid also, some part of upper eyelid also affected. So we are doing a corrective surgery. What I am normally doing is I am taking a 15 number blade, and can you just hold, I am just keeping my finger down to give a counter pressure from down, so that I get a good incision, and I am going to stay around 2 mm away from the margin and try to keep as close as possible for me. I am just giving a cut around this area, a proper cut. Cautery, can you keep ready? And can you give me one very fine forceps also? So in these cases, what I am doing is approximately I'll just see that how much inversion is there. Based on that, I am going to remove. But I am going to remove some of the skin from the medial lateral canthus also, because lateral canthus is going inside, and we need to reverse the lateral canthus also, because it's going inside. And I am little bit of the upper eyelid also I am rectifying, because if I don't rectify upper eyelid, sometime as soon as I do lower eyelid, it looks like it's going inside completely. So this upper eyelid also, little part I am doing this way, and then I am joining whole this part. Tenotomy scissors is ready. So normally I try to avoid using the cautery in these areas. So what I am doing now, I am just removing the skin which I cut it. Just keep a counter pressure here. You can use tenotomy scissor, or you can use regular scissor also. I am removing some part of the patellar muscle also from down. I try to remove initially a little smaller area, and in case if I have doubt, I may increase the lower eyelid, I may increase little bit more. Now these areas where these smaller bleeders are there, I will try to cauterize as minimum as possible. If we don't cauterize these smaller blood vessels, sometimes once you suture, there will be hematoma formation, and that will look very ugly, because it causes chemosis sometimes because of either bleeding, or if you are using even excessive cautery also. Now you can see that some part of this we have removed. I am just removing little bit more, because I kept little extra 3 mm. So 1 mm more the margin I am removing, the lid margin, because I want to stay very close to the margin, so that when I am putting the sutures, they just emerge like this completely. Okay. So I removed almost 4 mm of tissue. Can I get 450 PDS? 1 minute. I'm using 50 PDS to put inside stitches. Some people they put directly outside stitches, and I need 40 nylon also, or 50. Can you give me 50 nylon? Yeah. So this is a 50. You can use braided suture material also. You can use vicryl, but today I am using this monocryl suture material for the suturing. So my first suture I am putting from the lateral margin only. Sometimes you can give a deep cut and you can suture the muscle properly to pull it, but I am not doing that. Usually I try to do in Saint Bernard breeds, like when they have the very droopy eye and the eye is looking bad. Otherwise I try to avoid that. So when
Sir, I think this one will do next side only, sir. Like
now if you see, I put one suture and it's already little longer. It's looking better now already. Now what I am doing is I am just taking a small bite from ins to out. These all the knots I am keeping inside the tissue, they will not be outside. And as soon as I'll just put all these, you can see that it's not averting too much also, but the eyelids are started coming out already. You can see that. The main thing in this is, if you'll see, my incisions are very close to the eyelid margin, so that is most important to consider. Sometimes if you are not taking margin properly, and if you remove big chunk of skin also, it sometimes doesn't bring that effect of aversion of this third eyelid, eyelids. So you will not see a proper effect of your surgery completely. So as soon as I put these sutures, you can see that already the eye started looking better. It's everts nicely. Okay, looking better already. Sometime I do little extra also, but in this case, being these breeds are not problematic breed for me, but in case if I am dealing this with a Mastiff or with the Saint Bernard or a Chocho breed, I will do little extra, because their upper skin is already loose, and sometimes whatever you do, it's keep drooping again. So I do little extra, or I modify my technique, especially in Chocho and Saint Bernard. I do a modified technique where I leave some of the area open for the wound to heal, secondary wound healing. So that with the scar tissue, the eyelids go everted out and we don't get recurrence. Or sometime I remove the facial fold also, especially in Chocho. Some breed you need to do additional procedure to remove the face or forehead fold also. So this is looking good right now. we are going to put outside stitching now. These stitches I put inside one just to secure. Sometime what happen if dog has scratched this area, sometime these sutures comes out, and if these sutures comes out, it opens up. If your sutures are inside are secured, even within 2 days if outside suture comes out also, the wound will not open up completely, and then it can heal with the secondary wound intention. And that's also fine if it opens up little bit, and you can just still leave it like that. You don't have to suture it in unless it opens completely. If the edges are still opposed, you can avoid putting them under anesthesia again. Yeah. Okay, so you can see that it's already looking nicely. It's not going inside, these eyelids are not going inside. Now we are going to put outside stitches. We are using 50 nylon. You can see the 50 nylon which we are using for outside stitches. Can I get little better quality this needle holder? It's not holding these smaller sutures. Just I'll put one more stitch here inside before I start the outer stitches. Extra gap is here. This dog is having problem both the sides, so I'm going to do the surgery other side also with the suture. So you can cut only in these cases the upper portion of this. Lower portion you can keep a little longer, so that while cutting the suturing it's easy for us. The piece, the suture which is coming towards the upper area, we can cut. We can use even continuous suturing also for these cases. I am using interrupted suturing technique, but individual options are there, like usually some surgeons they do continuous suturing, some and they do. Can you cut upper one smaller little? Bigger, yes, that's all. So you'll just keep seeing that they'll stay downside, and so that they should not irritate the eye. But sometime if you feel still they are irritating the eye, you can do some changes in your planning. think from here a little extra. Normally, post-operative care is just cleaning the eye with the saline, giving one painkiller, anti-inflammatory, doing cold compression in this area. Second or third day, some of these cases you will get a chemosis here, the inflammation or edema in the conjunctiva. That happens sometimes because of excessive manipulation, or sometimes under this area there is some bleeding, or sometime if you are using the cautery excessively, you will get edematous swelling, but that usually get resolved with the anti-inflammatory and cold compression. Nothing we have to do specifically for that. 14th day we are going to remove the stitches, and normally they start doing well from second day onwards only. These are not surgery where I struggle too much. These are pretty straightforward procedures. So you can see that it's looking good. Eye is looking good now, and that's all about Entropion surgery. So thank you.